If you discontinued to watch this video at one point, then please tell me what the reason for it was so that I can improve. Otherwise, hi and welcome. I am trying to learn medicine today, aortic valve stenosis, and after we've done it, we're gonna do squat training. And if you participate in the squat training, then it's very harmless. Now we want to go now over the text of aortic valve stenosis, then try to gather the information together we need for our presentation, and then try to make that presentation out of memory. Aortic valve stenosis, and this is no medical advice, and we're talking about the blood system and about internal anatomy. A disease of the heart valves. The aortic valve, which consists of three cusps, valve flaps, normally opens with each heartbeat to let the blood flow forward to the body. Okay, the heart has multiple valves, and the aorta, do we say, has three of them, or three cups, valves, and they open now so that the heart is contracting, and then the blood should be pushed out, and the valves are opening, the blood flows into the aorta, and after the blood has flown in, the heart opens again, the valves closing again, so that the blood flows back into the heart. When diseased, the cups become thick, hard, and often fused. The opening is stenosed, narrowed, and obstructs the forward flow of blood, especially to the brain and coronary arteries. I'm right now not completely sure that we didn't have made the presentation yet, but let's just do it again. The opening is stenosed, which means narrowed, and obstructs the forward flow of blood, especially to the brain and coronary arteries. Okay, they become thick, hard, and fused. And that makes the opening become narrowed, stenosed. That obstructs the blood flow to the heart, to the brain, and to the coronary arteries. As well as being narrowed, the valve may be incompetent. I think that means they don't close properly. See aortic incompetence. Some people are born with the stenosis. It may follow infections in young people, or it may develop as a result of hardening of arteries. If we say it can be inborn by some people, but it can be also a part of hardening of the arteries. Okay, what was it? The valves at the aorta, for example, the valves at the heart, at the aorta, there are three of them. They don't open properly anymore because they are thick, hardened, and that narrowed stenosis the whole aortic entrance. And that obstructs the blood flow to the brain and coronary arteries. Symptoms: chest pain, angina pectoris, across the upper part of the chest related to exertion. Pain in the upper part of the chest, shortness of breath, dizziness, especially when standing up, fainting on exertion. Okay. Pain in the upper part of the breast, angina pectoris, fainting when standing up, fainting on exertion, dizziness when standing up, shortness of breath, dizziness when standing up, and fainting when fainting exertion. Duration: symptoms persist unless the condition can be treated. Causes: acute rheumatism in early life, which sometimes may go unrecognized. Okay, rheumatic fever in the early life, unrecognized rheumatic fever in the early life, and I think untreated, even if recognized and treated. The valves are inflamed and the three cups become fused and rigid as years go by. Okay. Untreated rheumatic fever in the early life, which causes the three cusps, so we know the cups of the valves, maybe both, the three cusps of the aorta to become fused into rigid, I don't know, rigid. Sclerosis, hardening of the valves, which occurs in older people. The cause of congenital aortic stenosis is not known. Okay, it can be congenital, so inborn congenital. It can be because of hardening of the arteries, hardening of the valves. But we had here hardening of arteries, so both. Hardening of the valves, that is sclerosis, and it can be sclerosis. And then the other thing is an untreated rheumatic fever in the early life, which causes the cusps, these three cusps at the aortic artery, to become fused and rigid. avoid too much exertion, but this is no medical advice. This not, and also the other video not. So avoid too much exertion and take care when standing suddenly from a sitting or lying position. Avoid becoming overweight, smoking and drinking. If you get angina, shortness of breath, dizziness or fainting, consult a doctor. If you know that you have aortic stenosis and there is a change in your symptoms, for example, worsening of angina or increasing shortness of breath, what the doctor might do, send you for x-rays and ECG and other tests to assess the severity of a stenosis. Surgery may be necessary, but if a strain on the heart is not great, then a regular checkup may be all that is required. There is a way that makes sense with sense. If a person does it has not too severe, it would be enough to make a regular checkup, because the regular checkup would know whether it gets too severe and when things would be done, otherwise not. It's just a regular checkup without doing anything, just advising to the next checkup is not really a treatment. But it is because it is now observed, and if not something happens, it can then be something. Suggest that you take antibiotics if you have teeth extracted to combat infections and prevent further damage to the valve. Okay. If someone has it, and it would be then assessed through an X-ray or ECG. ECG. It is an electrocardiogram, it's just spelled ECG. And when there are antibiotics, if a person has a tooth extraction or an infection, so that no further damage happens to the valve. Outlook: stenosis discovered by chance and causing few symptoms may change very little over the years. Okay? Discovered by chance and causing few symptoms maybe does not cause problems also over years, so they are observing would be enough. Severe stenosis may lead to heart failure and shortened life expectancy. Surgery involving valve replacement or splitting the valve in the young may improve the outlook. Okay, we're having as treatment antibiotics if a person has a tooth extraction or to combat infections so that it does not progress, and also maybe operation, surgery, that the valves are replaced or splitted. The cause are inborn congenital, and therefore the cause is unknown in this book, which is from the 70s. It can be a part of hardening of the arteries, of sclerosis, and it can be also through an untreated infection of rheumatoid fever. Is it an infection? We don't know it. Of rheumatic fever. We don't know what rheumatic fever is. Let's take one look. Rheumatoid fever, inflammation of the heart which sometimes follows an attack of tonsillitis. Rheumatic fever, which occurs most commonly in children, is often associated with poor social conditions. Many attacks are probably mild and pass unrecognized. The disease is less common than it was, but damaged heart valves following unrecognized infections are not infrequent. I don't really understand it, and we don't have time to read it completely. We're just going to say it can come through unrecognized rheumatic fever in early life, but which causes the free cups at the aortic to become rigid and fused. Now the whole problem is that the valves of the heart at the aorta, they become diseased and they become hardened and thickened, and that obstructs the flow of blood to the brain and the coronary arteries. I think we have it. There are antibiotics and the other thing. I'm going to start the second camera and now try to save it from memory. Aortic valve stenosis. Aortic valve stenosis, the three cusps of valves at the aorta become fused or hardened or thickened, and that obstructs now the blood flow to the brain, to the coronary arteries. So the blood is pumping and the blood comes into the aorta, but now these valves which are opening when the blood comes through and closing after the blood, they become thickened, hardened, and that obstructs the blood flow and narrows then the whole thing, stenosis now. Now, and the causes can be congenital, and the cause for that is here unknown. It can be because of sclerosis, hardening of the arteries, and it can be because of an unrecognized rheumatic fever in early childhood, which causes the cusps or the valves to become fused and rigid. If it is not too severe and is just caused, it is just found through luck or just found, then it may go also over a long time without big problems. If it is severe, then it can cause problems, also shortened life expectancy. And there are antibiotics that people get antibiotics if they have it, when they have a tooth extraction or something else that will combat an infection against that they don't get it more severe. And there are also surgical options that the valves are cutted or replaced. The symptoms are angina pectoris, pain in the upper part of the chest, and also fainting when exertion and dizziness after standing up. And that's according to Keith Hodgkin's Family Medical Advisor book on page 78, but this is no medical advice. I'm going to stop the camera. And that was the medical. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the squat training, that is at your own risk. We're bringing one leg up, the mushroom exercise. Pull the leg up, point with the toes down, relax the leg. Other leg. Pull the leg up, point with the toes down, relax the leg. And now, do the walk a bit on the place. Legs wide apart, and we're doing just for fun 12 squats. So the first one, and the second one, number 3, and 4, 5, and the next one, we're having a half. So that is 7 and 8, just 2 more, and we're having 10. And last 2, 11 and 12. Next exercise, the 6-pack squat squeeze. Legs wide apart, down into quarter squat, and press against the top part of a leg. Only on one side to train you, please. And press on the other side. Into half squat, and press in the middle of the leg. On the other side. And down into 3/4 squat, and press close to the knee. And on the other side. Up again. And now the fastest giraffe of the water pond exercise. Down into 3/4 squat, press against the knee, and go towards it. Press against the other one, and go towards it again. Press, go, press, and go. Again, last 2, and again, press, go, again up. Last exercise, a propeller. Down into full squat, arms to the side, over to one side. Press against the leg, look up to it. To the middle, over to the other side, press against the leg, look up to the head. Middle and up. And the walker again, walk a bit on the place. Let's do again the mushroom, pull the leg up. On the other side. And now also the crane, the animal exercise. Take the leg at the ankle. Make a straight back, and point with the knee down to the ground. Other leg. Straight back, knee down to the ground. Legs wide apart. Breathe in and go down. The trunk catalyst. Breathe out again down. Again in. And out. Breathe in and close the legs. And breathe again out. That was the squat training. I thank you very much, and until the next time.